My name's Dr. Gia Shaybani and I'm a gastroenterology and general medicine registrar in the southwest of England. I've just returned from work from maternity leave. To give some background, I had my daughter in August after having to work from home in March due to the coronavirus pandemic. It means I've been in some form of restrictions for most of my maternity leave and haven't actually had much human contact or patient contact for the past year, which wasn't my intention. As expected, I was a little nervous going back to work, which was amplified by going back into a hospital environment where there was lots of people. It struck me that there aren't many resources showing a real life journey of going back to work, and is even more important in the world we're living in. I decided to do a video blog to diary my return back to work and to normalise and talk out loud my feelings and share those with you, because undoubtedly there'll be other mothers and fathers who'll be feeling similarly to me. I won't talk too much about my daughter as that's not the focus of these videos, but it goes without saying that when I'm at work I do miss her a lot, and I think most people can relate. She's still only 7 months old. The aim is to release a video every week, and I would appreciate any feedback you might have to try and improve the accessibility of this and anything you'd like me to talk about specifically. Also, the names of the videos are not massively imaginative, but if you have any comments or any suggestions, I'd be really happy to hear them, so please comment below. Until next time, bye bye.
Hi guys, how you all doing? So I decided that I would start a blog. So I've been a mum for about 7 months now. I'm a doctor, I'm a gastroenterology registrar, and it's been a very weird time to be pregnant and have a child, I think it's fair to say. So I started working from home in March and was doing lots of clinics from there until my maternity leave in July. And so I haven't really been in a hospital for about a year from to give birth. I've had a lot of sort of, a little bit nervous about going back. And I thought I would sort of try and reflect on my experience of going back in the pandemic. So I am quite excited, obviously, to go back as well. I really love my job. I'm not going into a completely clinical role. I'm going to be doing some management and leadership and teaching stuff as well. But there'll be no doubt that I'll be seeing some COVID, which I haven't quite yet seen yet. I've kept myself quite busy during my maternity leave. I'm the co-chair for the BMA Junior Doctors Committee for our region 7, and that's kept me busy. So I've been able to see what's been happening. So why am I nervous about going back? So every parent, if or anyone who's taken a significant amount of time out will be nervous to go back. It doesn't matter what job you do. But the pandemic itself has brought a lot of other anxieties. So I've not really been out in big crowds at all in the past year because of all the restrictions. So I think that will feel a little bit overwhelming. There's obviously, you're always going to be worried, have you forgotten what to do? But I'm sure it's going to be like riding a bike. In fact, I've started revising for an exam and realised that a lot of the knowledge that I had is still there, which is great. And then obviously there's the normal worries of going back, isn't there? So, feeling like you're going to fit in. I'm going to a completely new, I say a completely new hospital. I've actually worked there before and I'm well known. Well, I was known there, but, I still have, I still was somewhere else for a year, and actually I'm going in mid-rotation, as it were. So lots of, the people there have been dealing with COVID and dealing with the way we're working, using masks and things more than I have. So that will be an interesting experience. I think as well, I think I'm going to miss my daughter. I've really bonded with my daughter. This has been an unusual time for any mom, or any parent really, in that we're at home a lot. I've not really had mom and baby groups to go to. Some of my family haven't even met her yet. It's been a very difficult time. But one thing I'll say is I've bonded really well with her, and I will miss her when I go back to work. But the thing I tell myself is I need to go back so that she knows she's got a mum who can do both. So I'll be releasing a blog every week. It'll be released hopefully on YouTube every Sunday. And I will be detailing a diary of everything that's happening, my feelings, and just reflecting on things. I really want to speak to any parent who's going through this at the moment, that you're not alone. And I'm hoping that the things that I'll voice will be things that all of you are experiencing at the moment. And I hope to take you on my journey, really, for the next, couple of months, if not longer. And hopefully you'll find it useful hearing my reflections. I'm always happy to answer questions as well, so if you comment on the video, and then I'll try and answer them in the next vlog. For now, that's all I've got to say, but I hope you do I hope you do follow my journey. It'd be nice to share my journey with whoever's interested in following, and hopefully it will be enlightening for you, and it will make you feel a bit more comfortable about talking about how you're feeling to your colleagues, to your supervisors, to your family, and actually knowing that most of what we're feeling is very normal. But for now, I'll say goodbye, and hopefully we'll catch up in a week's time. Bye. Hello guys, it's 5 to 9 on the 3rd of March, and I've just finished my well, not just finished, I've actually just been revising, but today was my first day back at work. It was nowhere near as scary as I was expecting it to be in my head, and actually felt like I'd never left. We heard a lot about COVID, and it was very weird for me because I've not really actually seen a COVID patient or been in that environment, but things do sound like they're getting better, so I think we can be cautiously optimistic. But they did, warn us that we still need to be careful, because what happened between the first and second wave was a lot of transfer of infection between staff and between patients because we relaxed. So it's important we don't do that again. One of the more interesting things I did in my induction today was go over our basic life support, and actually listening to the differences of how we manage a cardiac arrest in COVID is very different. One of the things that I've been reflecting on is how we really do need to look after ourselves first. So even if a patient's heart has stopped, actually we need to don our PPE, because that risk of generating aerosols and making you sick means you can't look after other patients. And that's going to be something I'm going to have to try and get used to. I mean, one of the tips they gave us was whilst you're there checking the patient over without starting chest compressions, one of the other team can don the PPE, who can then start chest compressions as soon as you think it's time to. One of the things I found quite hard was practicing paediatric life support. So I have a 7-month-old, and actually doing that, knowing that, my baby is at home, it takes your mind to other things, and it's quite sad to think about. Thankfully, paediatric arrests are quite rare, and it's probably something I'm not going to come into contact with, but it is something that, I had to practice today. I also went over how to use our beds. Hospital beds in the NHS are incredibly complex. They need to be able to do a lot of functions, not just sit the patient there, but also you need to be able to know which buttons to press in an emergency. You need to be able to know how to get your patient off the floor. And they're things that you take for granted as a doctor, but actually it's not uncommon for us to get involved in getting patients up the floor, and just knowing what sort of equipment you might need is quite useful to know. What else did I do today? The day sort of passed by. Oh yes, we went through the IT systems, which unfortunately haven't changed, although they have improved from the way they were. So the systems between GP and hospital are much more joined up. So if I've got a patient who comes in who doesn't know what medications they're on, I can actually go onto the GP system, which is quite rare for an NHS hospital, actually. It's certainly in my experience. Then had a meeting with our Director of Medical Education, and we talked about how we were going to get our educational bits. So part of my role is to provide education for the junior doctors. And actually my day tomorrow will be on the acute medical unit, providing support and teaching for the junior doctors, trying to get them, just watching them take a history and examine the patient and perhaps do some procedures depending on what happens during the day. And actually knowing that we can talk about these things really does feel like COVID is settling, and we can actually get on with supporting our trainees, because at the end of the day, regardless of whether COVID is here or not, we need to train these junior doctors to get their competency so that they can they can go on to other specialities. It's how I started. I didn't have an education fellow, but I see my role as being able to pass on my knowledge. And then I've been revising. So as a gastro registrar, and actually for any speciality, we have to do exit exams, which basically, if you pass it, it shows that you have the knowledge to be a consultant. So I'm, at the end of my second year of gastro training, and I decided during this time I would try and, study for that exam. So in between feeding Lily some bassa fillet and putting her to bed, and before I go to bed, I've spent a few hours reading about the physiology of the stomach, which is fascinating. Learning about all the different cells that the stomach has and which ones produce which hormone and how they interact with each other is absolutely fascinating. We learned it all at medical school, and learning it again, it's like I'm back at medical school again, but I'm doing it at my own pace, which is really nice, and it's allowing me to use my brain. Unfortunately, my little daughter is starting to cry, but she has now stopped, so I think I can continue. So in terms of reflections of going back into the environment, so it was nowhere near as daunting. Everyone was really friendly. I have been there before, which does help. I didn't feel as claustrophobic as I was expecting to feel sitting in a room. I felt very safe, actually. It was all one way. I was socially distanced. Everyone was wearing, we were wearing surgical masks, and actually I don't think we could have done that induction not face to face. Anyway, it's really, inductions are really important to us. Yes, it's not, the cutting edge medicine that you were hoping to hear from me today, but tomorrow will be an actual day on the ward, and that will give me a bit more, hopefully, to talk about, and what that's going to be a bit different. I'll be using my skills again, but I'm looking forward to it. Anyway, I need to go and see to my daughter, so I'll say bye, but hope to speak to you tomorrow. Bye-bye. Hello. So it's the 4th of March and it's my second day and first proper day on the wards again. I was on the acute medical unit today, and one of the first comments was about my hair, and actually I had been quite anxious about going in with my natural afro, and it was, although it was very complimentary, knowing that that's the first thing people notice does make you have it in the back of your mind. I've been concerned about going with an afro, especially being a one of the very few black sort of registrars around, especially in our region in the southwest. However, I carry it with a badge of pride now. It's really important that I represent myself as I am, rather than feel the need to relax or wear extensions, but I digress. So, sat in handover and heard about some COVID patients. Now, I want to talk a little bit about sort of my feelings about listening to real life patients with COVID, because I haven't actually been around COVID patients for the past year because of my pregnancy and maternity leave. It was quite alarming hearing how sick these patients can be. So I've dealt with quite sick respiratory patients in the past, particularly in flu season, but these ones seem, quite dramatic. One of them sounded like they might have had some clots on the lung as well. That on top of COVID in terms of breathlessness must be quite scary. And actually just listening to the junior doctors who've been dealing with it, you can tell they're really exhausted mentally. The psychological stress of dealing with those sick patients must take a toll. And actually me coming in fresh, I hope will take some of the burden off. Now, even though that sounds a bit depressing, I was actually really, really happy to be back at work. I get such a buzz from seeing patients and being in that environment and being able to make people feel better. So I heard about how the structure of the acute medical unit has changed since I was last there. So, they've got these red zones and the red zone of ED. So, the place where the COVID patients come in is now looked after by the acute medics. So actually they're everywhere. They were really quite well staffed today, more better staffed than I've normally seen it, which I think keeps the pressure off, especially at the busy times, which tends to be after 2 p.m. What else is there to say? Yeah, so my role really there is to try and support the junior doctors. So I'm really enthusiastic about teaching, and so I try to encourage some of them to come along with me to see some patients. They'd already seen the patients, so we actually discussed the management of these patients. The first patient was an elderly patient who essentially had some vomiting from what sounded like an infection, but also the vomiting had caused a little tear in the esophagus called what we call a Mallory-Weiss tear in gastro, which causes to vomit lots of fresh blood. And actually, at the moment, I'm studying for my gastro exam and had read about Mallory-Weiss tears only the other day and all the scoring systems in quite a lot of detail. So it really put me to the test, as well as being able to impart that knowledge onto the SHO who'd seen the patient. So he found that really useful. One of the things I'm normally keen to do is make sure that the patients have had a discussion about what their wishes would be in the situation that their hearts were to stop. Unfortunately, this we weren't able to because this patient was still in pain, but it's just being able to reiterate the importance of doing that. Even before COVID, that was my practice, so it's I found that's really important. We talked about how we approached that discussion. And the second patient we discussed was with a different doctor, was another elderly patient who had some chest pain, was known to have heart failure. And we talked about the different signs you might find in someone with heart failure and when you might give them treatment and when you might not. One of the diagnostic uncertainties can be what sets off the flare of the heart failure and the fluid on the lung, and actually trying to exclude a heart attack is really important. And we discussed how we would do that. And actually just getting back into that was really, really fun for me. As a registrar, it seems like relatively basic medicine, but actually it's the stuff I've really, really missed. I've really missed seeing patients. I've missed examining patients. I've missed interpreting chest x-rays and blood tests and things. And, it's why I do this. And this was definitely the right time to go back to work, even though I wasn't on maternity leave for the whole year. And then in the lunchtime, I actually set up a meeting with some other gastro registrars in the region, and we're thinking of setting up a trainee research network where we can collaborate on various projects. And one of the things we're probably all going to be very keen to do is look at how COVID has impacted some of our services. So we felt that was a very productive meeting, and actually, again, just getting back into that side, I really enjoyed that side. So the afternoon now is going to be spent, or the rest of the afternoon, there's not much left of the afternoon, going to be spent doing looking at emails, sending some emails around. I'm trying to sort out my week so I can do a bit more endoscopy and, liver clinics, which is what I really want to do. And trying to do some more revision. So yeah, the day didn't feel as hard as I thought it was going to be in terms of my, the anxieties that I had have basically gone. It feels like I hadn't really left. You find that a lot of the stuff you think you've forgotten is actually still there. And so I speak to anyone who's thinking of, who's worried about going back to work. It's like riding a bike. It really, really is. And I don't mean that in a patronizing way. It really is a case of once you're there, it all comes back to you. And I feel really well supported, and I think it's important to go back to an environment that especially when you've been away from work, and especially in COVID times. Just having that familiarity makes the day a bit easier. So there isn't much to say now. It was a fun day overall. I really enjoyed myself, and tomorrow is just meetings really of various guises. So one of those meetings, I'm going to be meeting one of the other chief registrars. So a chief registrar is very much the bridge between the junior doctors and the rest of the trust, to just go through some advanced life support, especially in the COVID setting, and just go through that and make sure I'm confident to carry the crash bleep when my time comes in a couple of weeks. And also just meeting some other people from the trust to see what projects I can help with. At the moment, Gloucester, which is where I am, are, they've got a good CQC inspection. They want to get outstanding, and I hope to be a consultant at this trust one day. So being able to get involved in projects now and help them on that journey it's very exciting. It's a very exciting time at the moment. So until tomorrow, look after yourselves. I hope that some of my reflections, particularly on a COVID patient, sort of reminds all of us that it is still around. It's really important we keep ourselves safe and stick to the guidelines as much, that are there, because they are there to make us safe. These patients with COVID were actually very young. So one of them was 40. And was very sick, was on maximum litres of oxygen. And as someone who suffers from asthma, has had asthma attacks, I can only begin to imagine what that breathlessness is like. So I think it's important that we remember that even though the cases are coming down, it's still very much around, and we need to keep ourselves safe. So on that note, I'll leave you, and I hope to speak to you tomorrow. Goodbye.